Good morning. It's so nice to see you this morning. I'm Kate Berg. I'm Director of Community at ByHeart and delighted to be here with you this morning. I'm talking to Dr. Jackie Douge, who is a pediatrician and co-author of the AAP statement around the effects of racism on young children, the mental health effects. And we're thrilled to be talking to you this morning, Dr. Douge. We wanted to dive into this work you did for the AAP, ask you a little bit more about the why and the what. And so thank you for speaking to us on behalf of Cluster this morning.
Oh, I'm excited to join you today, Kate, to talk about this important topic. So yeah.
Great. Well, I'm just gonna dive in if that's okay with you. The statement that you co-authored was the first time that the AAP has addressed the effects of racism on children. So I'm just curious if you can explain a little bit like why, why the statement came out when it did. It was a couple of years ago at this point, but why now? Why was this the right time?
I think it's a very interesting question. I think what most people don't realize is that the policy statements that are developed by the American Academy of Pediatrics can take anywhere up to 2 years, 18 months to 2 years. So the policy statement was really, like you said, it was published in 2019. Myself and my other colleagues, Dr. Maria Trent and Dr. Daniel Dooley, we had worked on this statement for almost 2 years prior to it actually coming out. And in addition to it, I mean, I can't say that this is this is the first official policy statement on racism by the American Academy of Pediatrics, but it's part of a long list of policies that the American Academy of Pediatrics has developed to really address what we call social determinants of health, right? Key social determinants of health, such as child poverty, homelessness, food insecurity, and social determinants really are those things that really that determine, right, the outcomes of kids' health. And so when we talk about social determinants, we talk about what are those things, those frameworks, those things in kids' environment where they learn, play, grow, worship, right, that impact their overall health and well-being. And racism is one of those list of things that impacts children's health and has been on this continuum of policy statements that the AAP has been building upon using expertise from pediatricians, researchers, educators, to really let parents know and let the organization of pediatricians know how we can impact kids' health by tackling these important topics.
So are you pulling from, as far as like what data you're pulling from, are you pulling from the social determinants? What other data do you pull from? Like, where does this statement really come from?
So, I mean, if anyone, reads the policy, right, my co-authors and I, we pulled from over 100 different research articles, okay? Even our own experiences in practice to draft this policy statement. So this is well-researched. This history, from psychiatrists, psychologists, educators, researchers, healthcare providers, that all this research culminated in developing this policy statement.
And what would you say were some of the key takeaways from the study? Like, what could we really walk away understanding about these long-term effects of racism on younger children?
So I think that's such an important question asked by cluster members, in the sense that for the community, right, is that one, racism impacts the health of all children, right? Not just children of color. It affects all children. I mean, there have been studies, and again, pulling that data for the policy statement, there are studies that show that even bystanders, right, those individuals who witness acts of racism, have there's an impact, a psychological impact on that child and that individual, as well as the person that's the victim of racism. The other key points to know is that racial bias, this experience of racial bias starts very early. We know developmentally, again, pulling from that research, right? We know developmentally that children as young as 2 to 4 can already start to experience racial bias. So racism starts early, it affects all children, and it does have a long-term impact. on children's health. And we can do something about it.
Because even at 2, even, you know, that unconscious, you're internalizing it. So it's staying with you. Another one of the outcomes, you know, the study talks a lot about chronic stress. Can you explain what stress does biologically to children?
So there are hormones in our body, specifically cortisol, which is important in terms of a stress response. So you can look at it this way: like there are hormones when we're stressed out, right? We either freeze, fight, flight, right? So it's normal for us to have stress, and we feel those changes in our body, right? But things like cortisol, which is an important stress hormone, just imagine over a long period of time being impacted by stress. One of those stresses being, for example, racism, that can over time can increase your blood pressure, can increase your risk for, which can increase your blood pressure over time, can also increase inflammation in your body, which can then lead to those long-term effects of high blood pressure, diabetes, and then also the mental health impacts like depression and anxiety. So stress really, and unremitting stress really can impact our long-term health.
Yeah, that makes sense. Well, I mean, I feel like these are not simple answers, but are there some key policy investments that we should be making right now to mitigate for this problem, to help this problem? And then, you know, additionally, like resources for parents and also for children, are they different? Are they one and the same? What would you suggest for both parents and children? So there are 2 questions. I'm interested in the policy investments that you would get behind or be excited to see come to fruition, and then just separately, you know, some resources that you would suggest.
So again, I think another great question, because I think it really underscores the fact that we can do something about racism, and we can do something in terms of prevention and mitigation of the impact of racism on children's health. And I think from a policy aspect, right, we have to look at again those things that shape kids' health and well-being, right? Um, do we have education for providers, I'd say both education as well as healthcare providers on addressing bias, right? Because we know that there's a history of systemic racism in a lot of the systems that impact children, both education, judicial, political, housing. So we really have to get to the root of why it is individuals, right? Again, we talk about individual bias, right? How we internalize racial stereotypes, generalizations, how that impacts how we make choices and decisions that impact groups of people disparately, right? Mm-hmm. So kind of addressing individually, even from a parent, like our own racial biases, but then also looking at again, like this policy, right? Really taking a lens, an equity lens on our policies to say, are we really making the best choices for communities, right? Like, take for example, how the COVID vaccine came out, right? Or even the whole issue of how the coronavirus affected populations differently. Many communities of color had higher rates of COVID. So again, you look at how much people are being paid, right? So they have access to health insurance, policies that address health insurance access, educational access. How are we decreasing educational gaps? Because that ultimately affects health as well, right? If you can graduate college, we know that you make a higher income and you're more likely to have access to health insurance versus someone who doesn't. So there are many different things that can be done on the policy level. And then even voting as well, addressing voter suppression. Those are important policy changes as well. If more people have access to vote and are educated about their right to vote, and that's on any side of the aisle, I think it's important about educating, having an educated consumer making better choices, right? And that's across the board. So those are some ideas for policy changes. For parents and children, I think first and foremost, knowing that the data shows and the evidence shows that kids really internalize bias early. There's an opportunity for parents to really start early to have those conversations with kids. I'm not saying that parents need to have, sit down a 2-year-old and say, oh, this is the history of systemic racism in the United States. Okay. Um, but I think first and foremost, how do we let our kids know that it's okay to celebrate differences, right? Um, Not taking a colorblind approach. There's no hair color, you don't tell your kid like you don't see hair color, right? So, and these are all things that make a person special, make them unique. So it's important to kind of lay the foundation that even though everyone is different, they may look different, have different hair color, eye color, there's this commonality, similarity, and really playing up our values, right, of kindness, compassion, empathy,
Mm.
um, and helping our kids stand up to racism as well. If they see a friend being bullied, if they see a friend being hurt, how can we help them help their friend, right? Talking to a trusted adult. And
Mhm.
also I think it's important for parents to model for their children the behavior that they want them to be the person they want their kids to be as well. So looking at our social networks, are they diverse? Where are we living? Is that diverse? Our social interactions, is that diverse and
Mhm.
inclusive? And how do we speak to our kids, or not speak to them, right? Because sometimes what we don't say is just as important as what we do say, and how we act. So I think those are important things that we can do as well. And then to kind of continue this conversation, I mean, I think this work to me is like so important because I know that if we can start early, we can make a difference. And again, it won't change everything overnight. I mean, we're not going to solve racism overnight, but I think it's a process, and if we can start early and really make that lesson learn, teach that lesson that it can start early, we can make changes early. It can really impact the health and well-being of generations of families and children.
And just considering too that these are children, are there any specific resources or places that you like to send parents, or that you find particularly valuable to have that conversation in a more delicate way for
Oh,
children 2 to 4?
yes. So one thing I'd recommend, the American Academy of Pediatric, the healthychildren.org website has some great articles. I did co-author many of them, some of them with my colleagues like Dr. Nia Hergaris, Dr. Monique Jindal, Dr. Shanta Anderson. So there's several articles. We even have an article about using books to help parents talk about race and racism. And we
Mhm.
also have talking about racial justice. So those are great resources. In addition, there are PBS Kids and Sesame Street have great resources for parents. To use media that kids are already engaged in to help parents have these conversations. And then lastly, I've developed a course as well on my website, on What is Black's website, talking to young children about race to really help parents have these conversations. And also we do, I'll offer Zoom calls, group Zoom calls, to kind of provide a little bit more one-on-one opportunities to talk through and help parents navigate these issues as well.
Great. That was a solid, helpful list, Dr. Douge. Well, I'm so happy to have had this conversation and to have gotten some of your time this morning. So thank you so much. This is such important work, and such a gift to be able to hear about it from you, from the co-author's mouth. So thank you again for breaking it down and where it came from and how it came to be. And I think the why it's so important is obvious, but still, lovely to hear about it from you directly. So thank you for your time and for the work. And this is wonderful.
It's been a pleasure. Thank you so much, Kate.